Genomics and personalized health represent a transformative approach to healthcare, utilizing an individual's genetic makeup to tailor medical treatments and preventive measures specifically to them. At its core, genomics involves the study of an organism's complete set of DNA, including all of its genes. This field has expanded rapidly with advancements in technology and holds the potential to revolutionize how we approach healthcare by moving away from one-size-fits-all solutions to a more customized model. Personalized health leverages genomic insights to predict, prevent, and treat diseases based on an individual's unique genetic profile, leading to more effective and efficient healthcare outcomes. The significance of this concept in shaping personalized health by 2025 cannot be overstated. As genetic testing becomes more accessible and affordable, it enables healthcare providers to understand patients' susceptibilities to certain conditions, allowing for early interventions that can significantly improve health outcomes. For instance, pharmacogenomics is a real-world application where a patient's genetic information is used to determine the most suitable medication and dosage, minimizing adverse effects and enhancing therapeutic efficacy. Another example is the use of genomic data to identify individuals at higher risk for diseases like cancer, enabling preemptive measures such as regular screenings or lifestyle adjustments to mitigate these risks. Proponents of genomics and personalized health argue that this approach enables precision medicine, improving patient outcomes and reducing healthcare costs by minimizing trial and error treatments. Furthermore, personalized health strategies can empower patients, giving them more control over their healthcare decisions and promoting proactive health management. However, several challenges and controversies accompany this burgeoning field. Ethical concerns such as data privacy and genetic discrimination are significant, as individuals might face biases based on their genetic information. The complexity of human genetics also means that our understanding remains incomplete, presenting potential inaccuracies or overestimations of genetic risks. These factors highlight the need for rigorous standards and ethical frameworks to ensure the responsible use of genomic data. Genomics and personalized health are intrinsically linked to other aspects of healthcare, such as predictive health and preventive medicine. By identifying genetic predispositions, healthcare systems can shift from reactive to proactive models, focusing on prevention rather than just treatment. This shift not only aligns with the goals of personalized health, but also fosters a more sustainable and effective healthcare ecosystem. As we look towards 2025, the integration of genomics into routine healthcare practices holds promise for a new era of personalized medicine, potentially transforming how we understand and manage human health. Advancements in genetic testing technologies are pivotal in revolutionizing personalized health by 2025. At its core, genetic testing involves analyzing an individual's DNA to identify genetic variations that can predict the risk of certain diseases, inform treatment decisions, and suggest lifestyle modifications. These advancements are instrumental in transitioning healthcare from a one-size-fits-all approach to a more tailored strategy, where interventions are customized to the genetic makeup of each individual. The significance of improvements in genetic testing lies in their potential to profoundly enhance predictive health. By identifying genetic predispositions early, healthcare providers can recommend preventive measures, allowing for earlier interventions that can significantly improve patient outcomes. This is particularly crucial in managing chronic diseases like diabetes and cardiovascular conditions, where early detection can dramatically alter the prognosis. Examples of real-world applications are abundant. One is the emergence of non-invasive prenatal testing, NIPT, which screens for genetic abnormalities in a fetus with unprecedented accuracy and minimal risk. Another is pharmacogenomics, where genetic testing guides the choice of drugs and dosages to maximize efficacy and minimize adverse effects, as seen in treatments for cancer or mental health conditions. Prominent voices in the medical community advocate for these technological advances, highlighting their potential to not only improve individual health outcomes, but also reduce healthcare costs by minimizing trial and error prescribing and avoiding unnecessary interventions. For instance, Francis Collins, former director of the National Institutes of Health, has emphasized how genetic testing can lead to more effective and efficient healthcare delivery. However, these advancements are not without challenges. Concerns about privacy, data security, and the ethical implications of genetic information are significant. There is also the issue of accessibility, as advanced genetic testing can be prohibitively expensive, potentially exacerbating healthcare disparities. Some critics argue that an over-reliance on genetic testing might overshadow other crucial aspects of health, such as environmental and lifestyle factors. Advancements in genetic testing technologies are intrinsically linked to other facets of personalized health, such as tailored treatment plans, lifestyle recommendations, and continuous health monitoring. By providing the foundational genetic insights, these technologies enable more informed and personalized healthcare decisions, making them a cornerstone of personalized health strategies in the coming years. As such, their evolution will continue to shape how genomics integrates into regular medical practice, thus influencing broader healthcare paradigms and patient care models. Genomics, the study of genomes and their functions, plays a pivotal role in shaping predictive health strategies by enabling more personalized health interventions. In essence, genomics allows us to understand an individual's genetic blueprint and how it influences health outcomes. Predictive health strategies leverage this understanding to foresee potential health issues before they manifest, thus enabling proactive measures rather than reactive treatments. This approach is crucial to personalized health, as it tailors preventative and therapeutic interventions to an individual's unique genetic makeup, promising more effective health management by 2025. The significance of genomics in predictive health strategies cannot be overstated. As personalized health gains traction, the ability to forecast health risks and intervene early could revolutionize healthcare, reducing both the incidence and severity of diseases. For instance, genetic testing can identify individuals at high risk for conditions such as breast cancer or heart disease, allowing for targeted surveillance and early intervention strategies. Moreover, pharmacogenomics, a field that studies how genes affect a person's response to drugs, can optimize medication selection and dosage, minimizing adverse effects and enhancing therapeutic efficacy. Real-world applications of genomics in predictive health are already emerging. One example is the use of whole genome sequencing in neonatal care, which can rapidly diagnose hereditary conditions and inform treatment plans for newborns with genetic disorders. Another example is the integration of genomic data into electronic health records, which can alert clinicians to potential genetic risk factors and inform personalized preventive measures for patients. Support for the integration of genomics in predictive health strategies comes from many quarters, including healthcare providers and patient advocacy groups, who argue that it enhances the precision and personalization of healthcare, potentially improving outcomes and reducing costs. However, challenges remain, such as data privacy concerns, the high cost of genetic testing, and the need for robust ethical guidelines to manage the use of genetic information. Controversies also exist, particularly regarding the potential for genetic discrimination by insurers or employers, and the psychological impact of knowing one's genetic risks. Additionally, there's debate about the extent to which genetic information should influence healthcare decisions, given that lifestyle and environmental factors also play significant roles in health. Despite these challenges, the integration of genomics into predictive health strategies is poised to transform personalized health. It connects with other aspects of healthcare, such as precision medicine and preventive care, by offering a foundational understanding that can guide individualized treatment plans and promote healthier lifestyles. As we approach 2025, the role of genomics in predictive health presents both a frontier of opportunity and a landscape of ongoing ethical and practical discussions. Personalized health. Tailoring treatments to genetic profiles refers to the innovative approach of using an individual's genetic information to guide healthcare decisions. This concept is grounded in the understanding that each person's genetic makeup can influence how they respond to specific treatments, their susceptibility to certain diseases, and overall health outcomes. Instead of the traditional one-size-fits-all approach to medicine, personalized health aims to customize medical care to fit the unique genetic profile of each patient. The significance of this approach in the realm of genomics and personalized health, especially by 2025, cannot be overstated. It represents a paradigm shift in how healthcare is delivered, promising more effective and efficient treatments. By considering genetic information, healthcare providers can potentially reduce trial and error prescribing, minimize adverse drug reactions, and improve patient outcomes. One real-world application of this concept is in oncology, where genomic sequencing of tumors allows for targeted therapies that specifically address the mutations present in an individual's cancer cells. This targeted approach not only increases the likelihood of treatment success, but also often results in fewer side effects compared to traditional chemotherapy. Another example is in pharmacogenomics, where genetic testing is used to determine how a patient might metabolize a medication. For instance, patients with certain genetic variants may require lower dosages of anticoagulants like warfarin to prevent adverse reactions. Proponents of personalized health argue that this approach could lead to more proactive and preventive healthcare. By understanding a patient's genetic predispositions, it is possible to implement lifestyle changes or surveillance strategies that could prevent disease before it occurs. However, there are challenges and controversies associated with this concept. One major concern is the privacy and security of genetic information, as misuse of such sensitive data could have severe personal and societal implications. Additionally, there is the issue of accessibility and equity, as the costs associated with genetic testing and tailored treatments may not be covered by all insurance plans, potentially widening the healthcare gap. Despite these challenges, the integration of genomics in personalized health directly influences predictive health, allowing for the anticipation and prevention of diseases based on genetic profiles. As such, it fosters a more holistic and forward-thinking approach to healthcare, emphasizing the interconnectivity of genomics and personalized medicine in shaping the future of health by 2025.